If you want to prevent your arthritis and osteoporosis from future, you have to maintain or you have to strengthen your bones. So much of people are going for fast food in this generation. This will lack so much of nutrients, vitamins, minerals also. So in this video we are going to tell about some tips and tricks that helps you to maintain a strengthening and strengthen your bones. So don't skip this video, let's go.
I played it innocent, a feel of discontent. I'm finally facing it all, fearless.
First is diet therapy and second is exercise and the third one is medication that you should be avoid. If you want to keep your bones healthy, you have to go for a better diet therapy. What is a major diet you have to add in your day-to-day life? First is calcium. For a human body, a requirement of about 1000 to 1200 milligram of calcium is required. But the people in this generation doesn't add this calcium in your diet properly. So, what are the main foods that contains calcium? First is a cup of milk. A cup of milk contains 265 to 275 milligram of calcium. And a cup of yogurt also contains 450 milligram of calcium. And for a cheese, a cup of cheese also contains 950 milligram of a calcium. And also taking a cup of almond in early morning also helps to cover 450 gram of calcium in your diet. And the next thing is soy milk, which also helps to gain 60 milligram of calcium in your supplement. So in this manner, these are all the common diets that helps to maintain your body or your bone healthy. These are all about calcium. Next we are going to discuss about vitamin D. What is the role of vitamin D? It mainly helps to absorb and retain calcium. And it is required about 600 milligram per day. So you have to add this vitamin D in your daily life also. What are all the main foods that contains vitamin D? Mainly a fish or meat, cheese, yogurt, mushroom, oats, orange juice, all this contains vitamin D. So this vitamin D and calcium are mutually dependent together. So if you want to maintain a proper bone health, you have to add this in your day-to-day life. Next we are going to discuss about magnesium. What is the major role of magnesium? Magnesium mainly helpful in absorption and metabolism of calcium. So you have to add this magnesium in your day-to-day life. What are all the major foods that contains magnesium? Mainly raisins and potatoes, sweet potato, spinach. This and meat also contains this magnesium. So you have to add magnesium if you want to maintain a proper metabolism of calcium. And the last diet you have to add in your day-to-day life is vitamin K. This vitamin K is important and it mainly helpful in bone mineralization and increasing bone density and also helpful in bone metabolism. Which are all the major foods that contains this vitamin K? Mainly a cabbage, cauliflower and liver of animals and meat, fish, spinach, all these contain vitamin K. Mainly vitamin K2 supplement. This vitamin K2 will available only in livers of animal. This is rarely available in these foods. So you have to add this vitamin K2 supplement in your day-to-day life if you want to maintain a proper healthy bone. So these are all about dietary methods you have to follow if you want to make this proper bone health and also prevent osteoporosis. After diet therapy, you have to go for a proper exercise. This exercise mainly helpful to maintain a proper bone health and also increase your bone mass and maintaining or strengthening your bone. Exercises mainly including walking, jogging, brisk walking and stretching exercise for your joints and mainly weightlifting exercises and also yoga. These all exercise will be helpful to maintain your bone healthy. So this is all about exercise. When it comes to last part of this video, mainly we are going to discuss about medications. Some medications will impact the bones health negatively. The first common medicine that you are using, mainly women, is hormonal contraceptives. These hormonal contraceptives will lead to decrease the level of estrogen and affect the bones health. And the next common drug is anti-epileptic drugs. These drugs mainly helps to decrease or prevent the episodes of seizure. So it mainly helpful to prevent the seizure, but it also causes the inactivation of vitamin D that may also affect the bones health. And the next common drug is proton pump inhibitors. These proton pump inhibitors mainly suppress the acid secretions that will leads to this absorption or intestinal absorption of calcium. So it will also affect the bones health. And the next common drug is glucocorticoids. About 30 to 50 percentage of people are taking or going for this glucocorticoids. So it will also create fractures and also reduce the health of your bone. And the last drug is the patient who are going for chemotherapy. Mainly the drug is methotrexate. This methotrexate will also cause your bone loss, will leads to affect the bones health negatively. So these are all the major drugs that will affect negatively for your bones health. And the last thing is you have to go for quit smoking alcohol and taking too much of drugs. So friends, that's all about today. I hope this video will be helpful to so many persons. If this video will be helpful, kindly share this to relevant people. And don't forget to like, share and subscribe. Next day I will reach you with another topic. Thank you all. Have a nice day.